I had a patient once that had gone to a nail salon regularly to get their nails cut, but the person nicked her this one time and didn't tell her, and then the following day the toe started looking a little bit red. In her case, partial amputation of that toe was performed.
Diabetic foot care education. What's the daily foot check routine for diabetics?
So you want to check your feet on a daily basis, and it's not just looking down but on the bottom of the feet. With diabetics, some diabetics have something called neuropathy. Neuropathy is where they don't have the same sensation as you and I in their feet, so they could potentially step on a pin tack and not feel it. That also then means that they could get a small cut in the foot and not feel it. So checking their foot, either flipping that leg up and checking and have a little checking in between the toes, making sure they're not wet, or using a mirror, put the mirror down on the floor and then hover the foot over it so you can see the bottom of the foot if you're unable to get your leg up. But checking the feet daily is really important.
Why nail trimming is riskier for diabetics?
Okay, again we go back to the it's twofold. So if they're neuropathic, often again if they cut themselves, they can sometimes not feel it. Or if they've got circulation issues related to the diabetes, i.e. the blood flow getting down to the feet is slower, if they do get a cut, they might not heal as fast. If they do get a cut, they might be at risk for infection, and that's again whether you're neuropathic or if you've got the vascular issues. If you get an infection, that infection potentially move a little bit faster in diabetics, especially if their blood sugars haven't been controlled well. And then that can lead to severe infections that can be more systemic or amputations. So that nail trimming can turn
into something really
very
serious.
quickly. Yeah. I had a patient once that had gone to a nail salon regularly to get their nails cut, but the person nicked her this one time and didn't tell her, and then the following day the toe started looking a little bit red. Her blood sugars weren't well controlled. By day 3 she had an open wound and had to go into the hospital. At the hospital they took x-rays and there were bone changes on that x-ray, and that bone change is infection that's gotten down to the level of the bone. And in her case, partial amputation of that toe was performed. So this isn't to scare anybody, but it's just to be mindful because again, the risk is quite high.
Especially when you're diabetic.
Yeah.